Hi, I'm Dr. Andrew Junak from Peak Physiotherapy and Performance. I'm going to teach you all you need to know about dry needling. So recovering from an injury can be a super frustrating process, and we all know this. You're mentally ready to get back in the game. Your body, however, may have completely different plans. If you're dealing with a lingering pain that affects your daily routine and your ability to meet your athletic goals, physical therapy will offer you a number of different treatments to help gain your strength, your mobility, and help reduce pain. Dry needling is one of those more popular techniques to help facilitate this process, and it can be very effective for pain management. Okay, so I want to tell you a little bit about what dry needling is. So these here are dry needles. Okay, so a dry needle is a monofilament needle that is inserted into different types of trigger points throughout your body. So let's say you have shoulder pain, all right, and you have a knot in the back of the shoulder, and that knot recreates a similar pain to what you experience. What we may do is we may do dry needling on that muscle knot or that trigger point. So dry needling is actually called dry needling because there's nothing being injected. The needle itself is going into your skin, but there's no liquid, there's no medicine, there's nothing else. It's just the needle. It's put directly into the muscle that is causing the pain. So it is one part of the physical therapy process. This process usually, if done correctly, includes exercise, some hands-on treatments with the dry needling, and maybe some soft tissue work. So it's this comprehensive approach which gives you the best benefit, but this is just one piece to that puzzle. There is some confusion about the difference between dry needling and acupuncture. So dry needling is based in Western medicine. It's highly researched, it's evidence-based, and it is great for providing some pain relief. One of the big differences between dry needling and acupuncture is the theory behind why it's done. In dry needling, we go directly into muscle that we believe to be causing our pain or some of the symptoms that we're experiencing. Whereas acupuncture tends to be a little bit more holistic approach, and they may be aiming for predetermined spots based on a number of different things. So they are two different approaches. The needles that are utilized are actually the same type of needle, but the approach and the theory behind what we're doing is very different, and the mechanism of what we're doing is very different. So to talk to you a little bit about how it's done, basically we will take this tiny monofilament needle, okay, right here. It is in a sterile encasing and package, so we will undo the package, place the needle directly on the skin after the skin has been cleansed, and then we will insert the needle. There are a number of different conditions that dry needling is very good at treating or helpful in treating, but some of the main things that the patient will experience first and foremost are a release in tension, a decrease in sensitivity in some of these muscle knots. So if you have a knot that's been lingering on you, this can help alleviate the tension or the pain associated with rolling out or massaging that muscle knot. It helps in reduction of pain. It helps to increase flexibility or mobility. It helps with range of motion. It helps to reduce inflammation. And what we typically find with dry needling is that it helps accelerate recovery time. You know, what it may take to kind of do with your hands and massage out a specific muscle or a knot in muscle may be able to be relieved with only 1 or 2 sessions of dry needling versus 4 to 5, maybe even 6 sessions of just digging deep into muscle to get it to release and loosen up. So some of the conditions that we use dry needling for specifically, I would say in my practice, we use it for sports injuries. We use it for muscle soreness. So if we have athletes that are competing at a very high level, they may come in for routine dry needling to help alleviate some of that soreness that they get from very difficult workouts. Muscular pain due to strains and sprains of ligaments or tendons. Tightness in muscles. So people who just have that general tightness, if you think about your classic office worker who has very tight upper traps and they feel like they sit like this all day, going into those upper traps with dry needling can help alleviate some of that tension and that tightness that they experience on a daily basis. We'll use it to assist with treating tendon injuries. So we won't actually dry needle the tendon itself, but we'll dry needle the trigger points within the muscle to help calm down the inflamed tendon. So it can be used to help cases of overuse and overtraining. A lot of people ask me, does dry needling hurt? This is kind of a loaded question because it's very person dependent. If we're comparing this to maybe a shot, like a flu shot, this is much less uncomfortable than any sort of shot you'll ever get, even from a context of drawing blood. What you can expect is a small poke when the needle's inserted. Some people feel this poke, some people don't feel the poke at all. If we hit a trigger point, you may feel one of two things. You may feel achiness within the muscle, and that ache may radiate to a similar spot that you have felt before, or you may feel what's called a muscle twitch, where it'll feel like the muscle jumps, but there's no pain associated with the muscle twitch. There's some research out there that says that the twitch itself is beneficial, and there's also research out there that says this muscle twitch doesn't matter. So depending on the provider that you might see, some might try to find a muscle twitch, but in most cases, the twitch does not matter. It's more so the technique of inserting the needle and hitting the target muscle that we're looking for. And then from a does it hurt perspective, at the end of the day, it does provide relief. So here's what you should expect after a course of dry needling or after a treatment of dry needling. You should expect some soreness for a few hours and maybe even up to a day. They've been shown that sometimes soreness can last up to 48 hours, but it's pretty rare. It depends on the type of technique that you're doing. There's many different techniques or ways to do dry needling. What we typically do is we place the needle or we insert the needle and then we let the needle sit. We don't move the needle around or anything like that. So we use a little bit more conservative form of dry needling. And with this, it limits the amount of bruising that someone might experience or trauma to the overall tissue. You can see immediate changes in pain relief and range of motion sometimes with dry needling, depending on what muscle group or what we're trying to test. And usually this treatment is repeated, sometimes at the same muscles and sometimes at different muscles, depending on the cause of the problem, at the very next visit. And usually visits are 1 to 2, sometimes 3 times a week. But there is no danger with using dry needling on multiple occasions with different patients. So where can you find dry needling? One common place that I like to obviously steer patients to, because I know what it is that we offer, is my clinic in Columbus, Ohio, Peak Physiotherapy and Performance. We use it as a part of a comprehensive physical therapy program. So again, not just dry needling. When you come to us, you receive corrective exercises, joint manipulation. We diagnose and figure out what the cause of your problem is. And then we pair all of this together with dry needling so that all of this stuff can kind of work together and build a very therapeutic outcome for the patient and help you get back to doing what you love. So our therapists are experts in dry needling techniques, and we've been very successful with treating adults, active adults and athletes with this technique for years. So if you're interested in some of our services, please click the link below and check out our website, or you can also schedule a free phone consultation to make 100% sure that we are the right fit to solve your problem. We do these phone consultations because we understand that physical therapy isn't cut and dry. Not every practice does the same thing the same way. So it's very important for patients to speak with their therapist beforehand, learn what to expect, make sure that the therapist can address the problem that they're trying to solve. And then from there, if the fit is right, then you can become one of our patients. All right. If you have any comments or questions, please put them below. And I hope you guys have a great day.